Ministroke, or transient ischemic attack, TIA, occurs when there is a temporary drop in the blood supply to the brain, depriving it of essential oxygen. The patient experiences stroke-like symptoms, although they don't last as long. In other words, a TIA is like a stroke, produces similar symptoms, but only lasts a few minutes and causes no permanent damage. Health experts say a TIA may be a warning. The right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. This includes movement and sensation. Vision is controlled by the back of the brain in the occipital lobes. Mini-stroke symptoms. The symptoms of mini-stroke and TIA are the same and depend upon the particular region of the brain that is affected. But while a stroke is permanent, a TIA, by definition, resolves its own. Neurologic deficits appear suddenly and can affect the ability to move or feel on one side of the body. Speech and vision can be affected. The affected person may experience confusion, difficulty saying words, or the inability to follow commands. Because the brain is a large organ, the whole side of an individual's body doesn't need to be affected. Symptoms may be limited to an arm or leg or part of the face. The deficits are also grouped based on the anatomy of the brain. As an example, loss of speech, aphasia, is associated with weakness or numbness on the right side of the body, since speech is controlled by the left of the brain. These symptoms are associated with problems in the anterior circulation from the carotid arteries. Mini-stroke treatment. The initial treatment is aspirin, second line is clopidogrel, Plavix, third line is ticlopidine. If mini-stroke or TIA is recurrent after aspirin treatment, the combination of aspirin and dipyridamole is needed, Echinix. An electrocardiogram, ECG, may show atrial fibrillation, a common cause of IS, or other arrhythmias that may cause embolization to the brain. An echocardiogram is useful in detecting thrombus within the heart chambers. Such patients benefit from anticoagulation. If the mini-stroke or TIA affects an area supplied by the carotid arteries, an ultrasound, TCD, scan may demonstrate carotid stenosis. For people with a greater than 70% stenosis within the carotid artery, removal of atherosclerotic plaque by surgery, specifically a carotid endarterectomy, may be recommended. The blood vessel is opened up and the plaque is removed. The carotid may be replaced with a vessel retrieved from the lower leg or foot. The procedure is not technically difficult but carries the potential complication of inducing a stroke. A stroke can occur during surgery or after the procedure. The chance of a stroke ranges from 1 to 4%. 9. Mini-stroke is a common disease, yet every individual needs unique treatment and care. We encourage people with mini-stroke and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about mini-stroke and how to treat mini-stroke, just click on the link at description or visit www.mainmd.com. Thank you.